Prynhawn, good afternoon. I'm Andrew Goodall, Chief Executive of NHS Wales. I will update you as usual about how coronavirus is affecting the NHS. Today, the overall coronavirus rate is around 110 cases per 100,000 people in Wales. This is significantly lower than the peak in December. But although levels are falling, there are still a couple of areas in North Wales where the rate is still more than 200 cases per 100,000 people. Thanks to everything that you are doing, we are making good progress in reducing the level of infections in the community. But overall, the situation in the NHS remains precarious. This is a challenging time of year for the health service as we balance the ongoing pandemic pressures, winter pressures, and other demands on all our health and care settings. We have 4 levels of escalation in the NHS which reflect the pressures in our system. Today, there are 8 hospitals reporting levels 3 or 4, the 2 highest levels of pressure. 2 hospitals are at level 4. The NHS has been under intense and sustained pressure over the last few months, but I'm pleased that we are beginning to see the lower levels of community transmission translate into lower levels of admissions to our hospitals. There are now around 2,200 COVID-related patients in Welsh hospitals. This is around 25% lower than the peak we saw in January. But there are still nearly 50% more patients with coronavirus in hospital beds than at the peak of the first wave in April. There are 84 people with coronavirus in critical care. This is nearly 25% lower than last week. But we still have 177 people in total in critical care units, which means our staff are supporting the equivalent of 116% occupancy, more beds than we usually have available. To help hospitals manage these pandemic and winter pressures, we've opened a number of our field hospitals. There are currently 202 people in field hospital beds across Wales. You may remember that I said earlier in the autumn that it can take several weeks to see rising community infection rates translate into higher numbers of hospital admissions and people needing critical care. The opposite is also true. It takes a few weeks for falling infection rates in the community to be felt across the NHS. We are now starting to see some easing of pressure, but it is not yet enough to enable the NHS to resume all its normal services. And it wouldn't take much to see the pressure increase again and the number of people in hospital rise to record levels again. It's very easy to just talk about coronavirus in terms of hospitals and hospital beds, but the pandemic has had an effect on every aspect of the NHS, and I would like to recognise the response that has happened in all of our settings, including our primary and community services. I wanted to give you a sense of the scale of the pandemic and its impact on our health and care services today. Around 175,000 people in Wales have tested positive for coronavirus. The real numbers will be much higher. Nearly 30,000 people have been admitted to hospitals across Wales to be treated for coronavirus. We are just beginning to understand the potential longer-term impacts of the pandemic. As the NHS position stabilises, we expect to be able to expand the level and range of activity taking place and resume services which have been temporarily paused. It's critical that we can set out a clear plan for resetting and recovering the normal NHS responsibilities across our health and care settings. During the pandemic, there have been times when the NHS has had to pause some services, but people have continued to be referred to the NHS for treatment. We now have a considerable backlog of referrals and demand. To meet people's healthcare needs, the NHS must continue to adapt so it can coexist with coronavirus for some time to come and transform the way many services are provided. We are introducing a series of new approaches which enable clinicians to prioritise those who are most in need and will help determine whether people can be more appropriately and speedily treated in another healthcare setting other than hospital. Eye care is a great example of this. Many people are now seen and treated locally by their optometrist without ever going into hospital. We will build on this and develop new care pathways in other areas. We are carrying out some detailed and urgent work in the areas of urgent cancer, cardiac and emergency care. These are areas which have continued throughout the pandemic as essential services. But even here, a backlog has built up, and there's been a reduction in people presenting with symptoms over the last year. At the heart of this work will be a balance between access to traditional services for physical health and support for people's emotional and mental health needs. Before I take questions, I want to say a few words about the health service's greatest asset, its workforce. In any normal year, our staff go above and beyond to provide care for people who need it, wherever they need it. But the past year has been extraordinary. NHS staff have worked under exceptional pressures, providing healthcare and support in the most extraordinary circumstances, without a break. The last few months have been some of the most difficult periods they have ever experienced. Clinicians and staff on the front line of this pandemic have experienced great strain and stress on both their physical and mental health over the last year. These are the same people we are relying on and who are doing such a fantastic job to deliver our vaccine programme. Part of the NHS and care recovery will need to be about supporting them to recover. They will have been through their own challenging personal and professional experiences. Our sickness and absence rates remain high. At this point last year, around 5% of our staff were absent. Currently, this is 8%, and it has been higher over recent weeks. Around half of this relates to coronavirus. And yet, for everything that they have been through, our GPs, nurses, paramedics, consultants, porters, therapists, and everyone else who is integral to making the NHS work and is fundamental to caring for and supporting patients, continue to show remarkable resilience. I want to place on record my thanks and personal admiration for the commitment of the NHS and care workforce in continuing to operate under such exceptional circumstances and helping to protect the people of Wales. Thank you very much. Diolch yn fawr. We are at a critical moment in the pandemic. We still need your support to drive down cases of the virus further, so the NHS can go on looking after you when you need it. You can help us to help you by following the rules, keeping your distance from each other, practicing good hand hygiene, working from home wherever you can, wearing a face mask in indoor public places. All of your actions will help us to keep Wales safe and to protect the NHS at this very challenging time. If you need help, please don't put it off. Dial 999 if you need emergency care, and if you require non-urgent medical attention, please contact your GP or call NHS 111. Thank you. Diolch yn fawr. I'll take questions from journalists now, and as usual, all of the answers will be broadcast live on our social media channels. So just moving first to Catrin Harve-Jones from BBC Wales. Prynhawn da, Catrin, good afternoon.
Dr. Goodall. You say there's been some easing of pressures in hospitals, though it's still precarious. Where do we need to be in terms of that pressure easing, in actual terms of numbers in hospitals for those suspended services, knee operations, hip operations and the like to resume?
Yeah, we have to, I think, keep an overview, Catrin, of all of the relevant measures that we're tracking. Some of those, of course, are around community prevalence and the positivity rates. But obviously, on a day-to-day basis, we are needing to monitor the NHS impact. And before Christmas, you may recall that we introduced a choices framework across Wales. That was to allow some flexibility for health boards to make some of their own decisions about how they would balance coronavirus care and treatment alongside emergency pressures and alongside elective care. That meant that there were a number, particularly as we were in the peak of our pressures, who did need to adjust some of their routine work, for example. But even over the last couple of weeks, some areas of Wales have, under that choices framework, been able to reintroduce some of their work as well. So where we have some flexibility in the system, I do want local organisations to make those judgments, but we remain still much busier than we were during the first wave when we stood away from routine activities to create capacity. Certainly where we are at the moment, given, as I said in my introduction, we have still 50% more patients in hospital beds for COVID-related reasons than we did in the first wave. I still think there is some time to come for us to feel that we have the capacity available. But rather than make that a national decision, I am looking for local health boards where they have flexibility to start to introduce some of those services. Just to finish off, Catrin, one of the things that is different during the second wave is that we had actually restored a number of activities, including in primary care, that we had originally stopped back in the spring. And I'm pleased to say, been able to maintain those safely in areas by taking protective approaches and, of course, making sure issues like PPE are available to those staff, particularly those working in primary care.
Diolch. Further coronavirus mutations of concern have been identified in England, very close to the border with Wales now. How much of a concern are these mutations for you in the NHS in Wales? And are you confident that enough is being done to contain all these new, quite concerning variants, and that you don't have to deal with their effects within the NHS?
Thank you, Catherine. It's inevitable that there will be constant mutations of the virus. That's just the way in which they will act to find points of weakness. In Wales, we actually have a strong experience of being able to identify through sequencing some of these variants ourselves. And in fact, we've been able to develop that approach to actually contribute not just on a UK-wide basis, but globally as well. But yes, it is of concern as these new variants emerge. So, for example, the Kent variant we know has really become very dominant in the Welsh context, more so in North Wales. But even now, up to 50% of the cases in South Wales will more link to the Kent variant. Obviously, over the last couple of weeks, we've particularly focused on the South African variant. Very small numbers in Wales at this stage, and at least we've been able to track it. But we do link with other agencies. We use some of our own experience. And of course, what we're always looking for is whether this is a variant that takes hold within a community. I think the particular concern about the Kent variant, as opposed to many of the other mutations that are happening, is simply the evidence that it was increasing the transmissibility. And that genuinely would be a concern for us. If that took hold very quickly, and given where I've described the NHS already, you could see quite quickly some of the improvements that we've seen reverse. So important that we carry on with that intelligence, but a lot of conversations also take place right across the UK to share that intelligence as well. Catherine, thank you very much. Diolch yn fawr iawn. Moving next to James Crichton-Smith from ITV Wales. Good afternoon, James.
Afternoon, thank you. You talk about North Wales having rates that are sort of still high. What do you think is driving the case rates in North Wales? Do you think it is the South African variant?
The evidence in North Wales would not be associated with that being the South African variant. What we do have in North Wales is evidence that the Kent variant that we've been tracking over these recent weeks is much more prevalent up there. And given the transmissibility of that, that would have influenced, I think, some of the community rates up there at this stage. I think there's a second aspect about North Wales as well, James. And I recall going through this during the first wave. Whilst the pattern this time means that the virus is more prevalent generally across Wales, there does still seem to have been a bit of a lag around North Wales receiving cases or identifying cases later than the rest of Wales. And I think we're still seeing that work its way through. Having said that, I've been pleased to see over the last couple of weeks just some stabilisation of those numbers in North Wales. And it's interesting that despite a recent growth that they've seen, they've still remained under the number of patients in hospital beds in North Wales for coronavirus. But it's certainly been more of a feature in the east rather than the west.
Thank you. With the Kent variant, it took a retrospective exercise to reveal sort of the extent to which that variant was actually going through the community. How confident can you be, despite what you said already, that the same can't be said for the South African variant, that actually it might be more widespread than we really think?
We're only aware to date of 13 definite or probable cases for the South Africa variant, and that number hasn't really changed very much over the course of recent days. We obviously do keep an eye on it. We've changed some of our testing regime, so irrespective of how we've been able to test in South Wales, we've had to link to lighthouse labs that actually have the arrangements in place to identify the South African variant as well. And at this stage, although we are monitoring it, there is nothing that is telling us that this seems to have been transmitted any differently in North Wales at the moment. I mean, you're right, James, we always need to continue to look back on the data and the intelligence as well as look forward, and it is a bit of a balance between the two areas. But from a public health perspective, and certainly advice, internally from our professional advisors in Public Health Wales, we're not necessarily seeing that as the core problem at this stage. We've probably had greater concerns about the higher level of transmissibility with the Kent variant that's been around and about us for some time now. Okay, thank you very much, James. I'm going to move on next to Dan Bevan from LBC. Good afternoon, Dan.
Good afternoon, Dr. Goodall. Thank you very much. The Chief Executive of Cardiff and the Vale Health Board said in a newsletter that he's expecting a decrease in the supply of vaccines in the weeks commencing the 15th and the 22nd of this month. Are you aware of those concerns, and what is your understanding of the situation?
So we have a very clear outlook on our supplies. You will have seen, of course, with our progress over the last 2 to 3 weeks, significantly our ability to ensure that we've been able to do a very high level of doses, and we've been able to see the population share increase as much as the individual daily numbers. You know, I was really pleased to see over this weekend us seeing 1% of the Welsh population actually being administered in a single day. We are having to adjust over the next couple of weeks to a couple of areas. You know, we will always have some limitations on supply that we need to align across the whole of the UK, and we work very constructively and openly with UK government to maintain those supplies. But there's also an adjustment that is happening around just a change of the administration regime, just tied into the inevitability that having started off with first doses being administered, Dan, that we now will have the first number of patients coming through for second doses as well. So our intentions is always to match the supply that is available to us and to maintain that, including the start of the administration of second doses within the system in line with the guidance that has been issued. But what we also hope to see will be an increase even on the activity levels that we've been seeing in Wales over the last 3 weeks or so, because of course what we have to do is to maintain our progress into the second group, the cohorts 5 to 9, and then we also need to incorporate the second doses as well. But what I would like to say is that, you know, we are very much on track for delivering the target and the milestone that was announced, that we would get through those first four cohorts by this weekend. And at the moment, all of our figures and the advice back from Health Board seems to say that they are in a position to deliver that, which I think is really fantastic progress.
Can I just clarify that, if that's okay, Dr. Goodall? So what you're saying is there is going to be a decrease in the vaccine rollout over the next couple of weeks, but it won't affect the targets that the Welsh NHS has got.
Yeah, there's nothing that will be affecting the targets that we've laid out, but whatever volume that we're able to discharge will always have to accommodate the supplies that are actually provided to, you know, all of us across the UK, including in Wales. So yes, we need to ensure that we can recalibrate for those areas. I mean, the other thing that would be helpful at this stage is, given the success of the rollout that we've had in primary care, is an ability to keep adjusting and considering the delivery model. And I think that the way in which the local centres and local GP practices have also stepped up alongside the mass vaccination centres is probably also a way in which we can just take advantage of the current situation with a good progress on the target.
Am I all right to get...
Of course, Sam, that's fine, yes.
Thank you very much. You've given a tribute to the NHS staff in your opening statement, but South Wales Police have said that they handed out more than 300 fines over the weekend to people breaking coronavirus rules. How much of a kick in the teeth is that to the NHS staff that you spoke so highly of when you see figures like that?
Dan, I've worked in the NHS for 30 years, and it's been a privilege to work alongside, you know, frontline staff throughout all of that time, and never more so during the pandemic. And I would just restate, you know, my thanks and my acknowledgement for the contribution that they've made to protect the population of Wales. I also said in my introduction that, you know, one of the reasons for seeing the reductions in community prevalence rates is actually because, you know, the public have worked with us, and I think that continues to be a feature and has been a feature right through from the first wave back in the spring. This is an enormous ask of people. It impacts on everybody's personal and day-to-day lives, but I would just really ask that people continue to work with us to help us to get to a better place, to allow us to consider how we can aim for some normality in society. I think one of the key points for us at the moment is to ask people to work with us on their actions, because we know that our rollout and the pace we're going out with vaccination will make a difference. So we will be able to protect the population, to stop people being seriously ill, and sadly to ensure that there will be no further deaths that will occur once we've had vaccinations occurring. So I just hope that the Welsh public will continue to work with us, and it's been really important to see that progress over these recent months, Dan. Thank you very much, Dan. I'm going to move next to Mark Smith from Wales Online. Good afternoon, Mark.
Good afternoon, Dr. Goodall. Thank you very much. Most public health experts say they cannot rule out a third or even fourth wave of coronavirus, depending on, for instance, the new variants and what happens in the coming year. With this, I'm sure at the forefront of your thoughts. What impact does this have on your ability to plan for this summer and beyond in terms of maintaining field hospitals and capacity in the NHS?
Yes, Mark. I mean, obviously, we've all had to track this through our roles over these recent months, and we are now coming through the second wave at this stage. But your point is exactly right. There are lots of positive developments at this stage. You're seeing reducing community rates, seeing the rollout of the vaccination programme. But yes, the modelling does show us that there could still be some difficulties ahead for us. We would hope that there will be some advantages from going into the summer months, because we know it's a virus that doesn't like the warmth. We saw that through last summer when, on the back of removing some of the restrictions, we were able to retain a lower level of prevalence at this stage. But the new variants do cause me concern. Even modelling that I'm needing to look at to oversee the NHS showed that there could still be some moments, even over the forthcoming months, and despite vaccination, which is why we do need to ask the public to keep working with us and complying in that way. From an NHS perspective, it does cause great difficulty. Originally, in our planning through last year, we would have initially been planning for a 3 to 4 month period of time. And obviously, we're coming up for a year anniversary at this stage, and there will still be an impact of coronavirus for some months to come. Having said that, whenever there is an opportunity for the NHS to be able to restore some of its normal and routine activities, we need to take those moments. And what I would really like to ask of the NHS is that the amount of change that has taken place, the way in which we have had to really think very differently about how we provide care and treatment, we absolutely need to maintain that, because we can still, I think, treat many members of the Welsh public by actually working in a very different way into the future. So we shouldn't just be working through some of these changes just because of a pandemic response. We should be working through in that way because it makes a difference to the outcomes for the people of Wales.
Thank you very much indeed. And secondly, statistics appear to suggest people are now spending a longer time in hospital and intensive care with coronavirus than perhaps during the first wave. Can you shed any light on what is causing this and what impact it's having on hospital services?
So I think I would comment on perhaps the data on the one hand, and then maybe on the experience. So I was just looking over the last couple of days on our numbers coming into the NHS, comparing the first wave with the second wave experience. So interestingly, the age of a patient who will have coronavirus has stayed about the same. That's about 68 as an average age. And the length of stay for people who are coming into a hospital environment has also stayed the same. It's around 15 days or so, about 3 times longer than a normal emergency medical admission coming into our services. So I think that there's quite a lot of data, including even in critical care, that is showing us that the overall experience as percentages is quite similar. But I think the thing that strikes me in this second wave is clearly, and I've been reporting that our numbers have been much higher than in the first wave, it's been a higher volume of patients coming into our system, and therefore that will introduce a different set of experiences for our staff, who will have seen, for example, many more younger people going into critical care units, for example, than they would be used to, who they're needing to give care to at this stage. So I think when the numbers are looked at, actually there's quite a lot of similarities. I think that the stark thing in terms of the experience on the second wave, though, is in an area like critical care, because of that volume, we've seen about a quarter more deaths simply in a critical care environment, and whatever staff have done to try to support individual patients and families, I think that's a rather salutary reflection, unfortunately, of the impact that this virus can have. Mark, thank you very much. I'm going to move next to Mark Hutchings from 5 Live.
Thanks very much. I've got a bit of a dodgy internet connection, so hopefully you can hear me. I'm here at Glangwili Hospital in Carmarthen. We've been speaking to critical care staff in particular, have been talking about the enormous pressures they've been under, and as recently as the last few days, with a fear that some are being driven to, across Wales, to perhaps leave the profession, to leave critical care. Is that something you're aware of, and what can you say directly to them, to those staff who feel now at the end of their tether?
Well, Mark, first of all, I would say, thank you to them for everything that they have done for their local communities and for their population. I've deliberately focused in some of the previous press conferences on critical care because whilst this has had an enormous impact on staff in all areas, it has felt pretty relentless on critical care itself. And as soon as they have seen improvements in the number of coronavirus patients who they are caring for and a reduction happening, they've obviously had to compensate for that by actually receiving in other non-coronavirus patients into their environment as well. Over recent weeks, including the peak that we've seen through the second wave, we've seen critical care capacity across Wales under plan stretched to about 150% of its normal capacity. Even today, as I was saying earlier, 177 patients across Wales. That's nearly 20% above the normal number of beds that we'd have in critical care. So I would give you a sort of a mixed view. I mean, firstly, I think during the pandemic response, the way in which we were able to draw in volunteers, interests, apprenticeships, and in fact we have nearly 5,000 more staff than a year ago in our services, it's given people some insight into the level of care and career progression that they can have in the NHS under the most difficult circumstances. But the thing that worries me is that inevitably there will be staff and colleagues who have had some very difficult personal experiences, will need to find a way of recovering themselves, and hopefully we can find a way of wrapping our arms around them to some extent for the support that they need. I think they need to have some hope into the future as well. So we've deliberately tried to focus over recent years on who are our future staff, so what is the pipeline. So even investments in areas that would allow additional critical care nurses to come through, for example, about a 70% increase in nurse training places or physiotherapists posts increasing by 50%. We've got to make sure that people know that there is a way in which they will have other future colleagues working alongside them as well. But my final point is that I think we need to recognise that I think that when we come through this pandemic, many of our staff will need support probably for some time to come, because I don't think that they will have fully appreciated all of the personal and professional impact that this pandemic response will have had on them.
And if you could still hear me, to expand on the point about the effect on the NHS, we talk about long COVID as it affects individuals. I wonder what about long COVID, if we can call that, and its effect on the NHS in Wales. How lasting do you think the effect of this pandemic will be on the NHS in Wales in terms of being able to provide a comprehensive service in the years to come?
Yeah, well, Mark, whilst in the short term, I hope that we will take the opportunities where they exist for us to adjust and resume activities. So where locally it feels that is possible to do so. We are working our way through a reset and recovery plan for a range of different activities across Wales, which will include, cancer and urgent treatment as much as it includes those patients who will be on our waiting lists and times. So I think it will take us some time to work that through, to make different judgments about what we need to do, not least because we still need to work in an environment where coronavirus may still be present as well. But I would just advocate what I said earlier in answer to a question, is that I also think that we've learned an awful lot about that we can provide excellence in our services that are just different from the offer that we've been making over the last decade. And the ability to use technology differently, the ability to use other professionals differently, and in particular, and it's our strategy in Wales, a healthier Wales, to actually allow ourselves to balance the care that is provided in hospitals along with our services in primary and community care as well. So, but I'm afraid this will be a longer term issue for us to progress at the moment. But I do hope that if we can come through the vaccination process, if we can see those lower community prevalent rates, that actually we can start to make a start on recovering those patients into our system. Mark, thank you very much. I'm going to move next to Dan Barnes from the South Wales Argus. Good afternoon, Dan.
Afternoon, thank you very much. Can I just ask, our area is Gwent, and case rates across Gwent are continuing to fall. However, the rate of the reductions has slowed in recent days, so is this a cause for concern?
So it's been good to see the change in the community rates in Gwent, because they were obviously, as you'll recall, Dan, amongst the highest that we had in Wales, and have had moments even in the levels that we were dealing with before we went into the fire break. The Gwent area actually had a number of areas where people obviously weren't able to move outside of their unitary authority areas. I think as you see the numbers lowering, and remember it was a peak in Wales of around 650, we're now down to about 110, it will sometimes just slow just because the numbers are getting much smaller. I would be worried if we see too much stabilisation of that at the moment, because the public are being very respectful and broadly complying. We know there's lots of measures that are telling us that people are wanting to comply with the lockdown arrangements at this stage. But I do hope that with some of the good practices in our Bevan Health Board, and also recognising that they are starting to see some reduction in the number of COVID-related patients in their hospitals, that will give people a bit of hope that there is also improvement going in there more generally. The new variants do start to cause some problems for us. So the Kent variant, as I said, is more prevalent across South Wales, and I do worry that maybe is one of the factors that could be affecting those figures. But if I was hopeful, Dan, I would hope that maybe we will see just some further improvement in those numbers over the next 7 to 10 days or so as well, and we'll just have to wait and see.
Yeah, thanks very much. With that in mind, quite a few areas in Wales have case rates of below 100 per 100,000, and some are as low as 50, which was the old benchmark for easing lockdown restrictions. So is that benchmark still in place, or is it too early to say?
Well, the coronavirus control plan still remains, which does give a series of triggers, at least for consideration. It's good to see the rates going down, but I would emphasise the point that you've just made is that even running at over 100 per 100,000 population is much higher than we would have tolerated, for example, back last summer. And I think we just need to recognise that whilst there's been significant reductions, we do need to make sure that these are sustainable changes. My role and objective today, in part, has been to share the NHS pressure. And of course, one of the key measures that we're tracking at the moment is actually the impact on the NHS. And at the moment, the NHS is still under considerable pressure. And that would be something that would need to be considered in any process that's overseen by the First Minister and Cabinet about where things go next. But it's certainly encouraging about the lower community levels. But I do think we need to recognise that, as I said earlier, the NHS still feels quite precarious. We're in a better position, but we obviously need to still see those numbers coming down even more strongly over the next few weeks in particular. Dan, thank you very much. And just moving now to the last set of questions, which are from Nathan Shoesmith from the speaker.
Thank you. Good afternoon, Dr. Goodall. You've discussed the need to support NHS staff following the pandemic due to the impacts of the coronavirus on them. Can I ask you a bit more about that and how long you feel such support may be needed, and whether you feel that there is appropriate and enough mental health and other support out there to support staff both now but also to deal with any surging capacity once the pandemic does come to a close?
Yeah, so I think we have two responsibilities in this arena. I mean, one will be to provide the mental health and emotional health support that the population needs more broadly. And I think that irrespective of having maintained mental health services throughout the pandemic response, we have all lived through something extraordinary, and I think there will be lots more implications for the way in which society will want to be supported in its mental health needs for the future. But in terms of our staff across Wales, really important that we discharge a duty of care to staff who have fantastically supported the population of Wales in an NHS response on a consistent basis and through the two waves that we've experienced to date. There are packages of support that are already available. They exist within individual organisations. I know they exist within individual teams, but there's also a number of national arrangements that we've put in place to make sure that we're able to signpost people to the right levels of services, including hosting arrangements at Cardiff University, for example, we've extended actually to a broader range of staff. We have two workforce organisations in Wales who deal with health and care. That's Health Education Improvement Wales and Social Care Wales. And they also are helping us with some of our national thinking around what wellbeing support would look like. But I think there is a little bit of a danger of us thinking that the pandemic response, is over once we hit all of the community triggers, that vaccination has been done. And I personally feel that we will see staff who will be struggling from some of their experiences, for several years possibly. And I think it will be important that the NHS is able to continue to support them in their personal assessment of the situation and to make sure that they're able to carry on providing support to the NHS on a day-to-day basis.
Thank you. And you've discussed how hospitalisation levels remain high in some areas, and you've talked about the staff absence levels. Do you feel that there's enough staff available at the moment to cope with the capacity in the areas where levels are highest, and could we see staff being redeployed or do you think even more staff and service personnel need to be brought in to support the NHS?
Well, given where we are at the moment, I think workforce is still a real constraint. I mean, if you think about what it means to lose 8% of your staff across Wales, that means that we have many thousands of staff who are unavailable to carry out their duties. We have more staff within the system than ever before. That's inevitable as part of what we needed to do to support the pandemic. But some of our intentions to support services will have been affected by the availability, particularly of specialist staff, who are needed in individual areas. So as an example, the only way that we were able to expand the intensive care beds in Wales was by stopping other activities that would free up, for example, experienced theatre staff who would be able to provide that kind of clinical care that was necessary, to provide the anaesthetists who would step away from their operations that they were supporting in order to provide care in those areas as well. So the NHS will always need more staff. It's why, as I reflected earlier, we've tried to ensure that we are continuing to invest in the future of our workforce as well as those that are with us now. But given hopefully that the evidence is that we are over the other side of this, at least this second wave, and that we have encouraging signs of some of the impact on the hospitals, I'm hoping that we should be able to start to use some of our workforce around some of their routine activities, possibly over the course of the next few weeks and months. Nathan, thank you very much for those two questions. That brings us to the end of the questions for today. Thank you very much for listening. Diolch am wrando.